The CAR-CIK are basically T cells which express some NK marker and are probably one of the type of cell that has been so far extensively used in immunotherapy even before the CAR-T era. The advantage of this cell as compared to normal T cell is that even in the allo setting, the risk of allo reaction, which means substantially GVHD or other type of reaction related to the allo reactivity, is very minimal. So we don't know the reason still about this peculiarity of these T cells, which is a matter of different polarization of T cells in order to get these cells. And that has been proven in our experience even when we decided to move on in the CAR-T and introduce a CD19 CAR-T against the CD19 and to test in the allo setting for relapse refractory acute lymphoblastic leukemia in pediatric and adult. And the result that has been in press in the Blood Cancer Journal right now, it clearly demonstrated what has been shown in the phase 1 study. So the advantage of these cells, which has been devoted and developed in our setting, are firstly the type of cells, secondly the fact that you can use allogenic source, and thirdly, which is probably the most important, that we use non-viral approach. And the rate of success in terms of achieving remission, at least in the context of acute lymphoblastic leukemia, relapsing after stem cell transplantation, has been very similar to what has been obtained by commercially available CAR-T cells. Why in the AML context? So far, we didn't achieve the same results as we did in the ALL or lymphoma setting, simply because the AML context is rather more complicated. And there are many issues that, of course, are needed to be tackled and considered and taken in consideration for that. Firstly, the type of antigen, because most of the antigen are basically shared with the leukemia, with the normal stem cell. And accordingly, even in the future development, you have to think about a sort of bridge to transplant if you really want to use the type of immunotherapy approach. The second, because the microenvironment for the AML is heavily protecting the leukemia stem cell, and even worse, they are playing against the use of these cells in the immune system and the immune cell in that context for several reasons. Immunosuppressive cell, another type of crosstalk between the microenvironment and the AML. What we are going to move on, at least in our context, is to use the same platform, which again is an allogeneic platform, CAR-CIK, for the benefit I had already explained, and use a sort of logic gate dual target that is going to be, to some extent, potentially be more effective, more selective against the target, and as a second hope, I have to say, to be more, to be safer in terms of target toxicity. This already in place in the preclinical setting, and all the data has been already published, and we are moving towards, because we are an academic investment, and I want to stress this point. In Europe, there are very few centers dealing with academic effort to move on from preclinical to men in the clinical setting. And so we have already almost completed the investigator medical drug products, which is, of course, essential. And we have already planned jointly pediatric and adult with the colleagues from the adult hematology department in Bergamo, which is a city very close by to the place where we are doing our work in the pediatric setting, which is Monza. And so we hope to open the study as a phase 1 study by the end of this year.